We're very happy to be here today and to welcome you all to the first in a series of talks that will describe child health in the 83rd Texas Legislature, what to expect. And so we're going to start this off today with a couple of views on what is coming up in the legislature, what bills are pending so far, and kind of where we're going from here. And so to talk about what to expect, we have Lauren Dimitry from the Health Policy Associate from Texans Care for Children in Partnership for a Healthy Texas. And then I will be speaking on behalf of the Center. Just a word about the Center to start off. The Michael and Susan Dell Center for Healthy Living is an international leader in conducting research and providing programs that promote healthy living for children, their families, and then their communities. Our vision is healthy children in a healthy world, and we know that you can't have healthy children without having healthy parents and healthy environments around them. So that's why our work fosters improved health behaviors among youth, influences policy and environmental change to support this healthy living, and then to advance the fields of education and community service. And so for our first guest speaker today, we'd like to introduce Lauren Dimitry, MPA. She's a Health Policy Associate for Texans Care for Children, and she also works with the Partnership for a Healthy Texas. She joined Texans Care in 2010 to focus on child health issues leading up to the 82nd legislative session. Lauren previously worked as an editorial assistant at the Austin American-Statesman, as an AmeriCorps member with survivors of domestic violence, and as a sustainable consultant focused on corporate social responsibility, which is really a upcoming trend these days. She holds a bachelor's degree from the University of Texas in Government and received her Master's of Public Affairs from the UT's Lyndon Baines Johnson School of Public Affairs in 2010. So welcome, Lauren.
Thank you so much, and welcome to everyone. I'm very happy to be here today to talk with you all about what's going on with the Texas Legislature. I am with Texans Care for Children, and as Texans Care for Children is a steering committee member of the Partnership for a Healthy Texas. And so at Texans Care for Children, I actually focus on all policies related to children's health, but a big focus of the work that I do is with the Partnership for a Healthy Texas on childhood obesity, nutrition, and developing healthy policies that will help Texas children stay healthy and be healthier. So on the next slide, you can see this is a little bit of the mission and guiding principles of the Partnership for a Healthy Texas. For those of you who are familiar with how policy work goes, it's not uncommon for groups who have issues that they want to collaborate on, work together to form a coalition and do that together versus doing that individually. So the background really on the Partnership for a Healthy Texas is that there were a lot of organizations that were starting to become interested in what the state could do to address the childhood obesity problem, also the adult obesity problem. And in 2006, these groups formally came together to form the Partnership for Healthy Texas. And that's not uncommon in the policy world, that you find that a lot of groups are working on a similar issue and then come together. So the mission is really to develop and promote policies that prevent obesity in Texas. And you can see that primarily we focus on the legislature, but in order to do that well, that means that we collaborate with interested parties. We try and bring everybody to the table to vet different policy solutions. And when we do this, we do most of this work during the interim. So as many of you know, we are in the middle of, or have begun, the 83rd legislative session. So all of the work with vetting our policies is done prior. And so by the time we come into session, we have a legislative agenda that I'll take you through in a little bit. But I did want to make one note, is that we promote evidence-based strategies. And this is really important because one thing that we really pride ourselves on is that all of our policies go through a pretty strict vetting process that is evidence-based. And that's really important because we need to go back to the legislature and be able to show that we've made a difference with these policies that they've passed, or else we run into issues of the legislature really wanting to see a return on their investment and on taxpayer dollars. So you can see, if you want to very briefly take a look at who we are, you can see that the coalition is, the Partnership for a Healthy Texas is a broad-based coalition. This is a huge strength in terms of advocacy because we can bring providers to the table, advocacy groups like mine. We can bring hospitals, folks involved with, schools, and this is a real strength. We can all be reinforcing each other's messages with the legislature. We can be in agreement, and we have essentially a large pool of organizations to represent us at the Capitol. I will say one thing, and I'll note this later on when I take you through the priorities, is that when you have a broad-based coalition, you have to get agreement on your legislative agenda, which means that not every organization is necessarily going to be in a place to support something. So that is quite a long process to develop a legislative agenda that all of these organizations can sign on to. So next, I thought what I would actually do is just sort of briefly provide you a recap of what happened last session. And this is really just to give you a sense of, in 2011, there is a lot of interest in obesity prevention at the Capitol. And you can see there that 75 bills were filed related to obesity, and 27 of those directly related to partnership priorities. And I will tell you that things are looking a little different this session in terms of the frame. But the thing that really framed the 82nd legislative session was that we entered it with a budget deficit. The state had a budget deficit of about $27 billion. And many of you may be familiar with how that ended up impacting schools and our health system. But I just want to note that because that means that when we were going to the legislature with our legislative priorities, we had to present them with options that were revenue neutral, essentially, or that had no fiscal note. And for those of you familiar with that process, that's something that happens with the Legislative Budget Board. If you have a bill, they will tell the legislature how much it will cost the state. So all of our priorities had to have a zero cost to the state, essentially, last session. So what did happen? This is just sort of the real brief recap of what happened last session. Senate Bill 226 passed, and really what that was doing was correlating our FitnessGram data, so that data that tells us how fit Texas students are, with their academic data. The partnership really wanted to see this pass because essentially we know that academics and fitness are related, but it's difficult for us to show that unless we can correlate that data. We had a bill passed related to the summer feeding program that was essentially an expansion of that program to make sure that children who are suffering from hunger in low-income areas have access to food during the summer and that it's nutritious. One important thing that did happen was that FitnessGram, previous to the 82nd legislative session, was required of all students in all grades. After the passage of Senate Bill 8 in the special session, it is now only conducted in a class that meets PE requirements. So that was something we opposed. We had policy threats to actually remove FitnessGram. So this wasn't exactly a win for us, but it kind of comes in a legislative sense. So that's last session. I'll move you on to what's happening this session. These are the Partnership for Healthy Texas priorities for this session. And so these are all those organizations that you saw earlier. These are the priorities that have been agreed upon and that we are all working to advocate for, lobby. You can see first up are the fiscal priorities. This is something that if you happen to work on policy, you may know already, but it was something that sort of was new to me when I started this work, which is that a lot of policy is driven through budget decisions. We have standalone bills, but a lot of what goes on in obesity policy is related to how what is funded within the budget. And so the first two items fall in what's called Article 2 of the budget. So this is all the health spending. We would really like to preserve the school health network. This is sort of the resource for schools to implement coordinated school health, which many of you might know is the evidence-based practice of administering and coordinating health that has been legislatively mandated in Texas schools for about 10 years now. The School Health Network supports that. It's in jeopardy right now. The Department of State Health Services has done a lot to try and string together funding for it, but there is no dedicated funding for it at this point. So we'd like to see that. The Department of State Health Services also has an item to fund some obesity prevention programs in their exceptional items. So they're asking for a little bit extra to do this, and we want to support them in that. And then the last fiscal priority is about the Texans Feeding Texans program. This is not in Article 2. This would be in the Texas Department of Agriculture section of the budget. And this is also a fiscal priority in that we're asking them to fund this program that allows food banks to donate, farmers to donate produce to local food banks. These policy priorities are with the school and community, and they are standalone bills. So these are bills that will be filed. The first one you can see has already been filed, actually. It's Senate Bill 134, for those of you interested in taking a look at that. This is a restoration of PE in high school. In 2009, this was cut. This is a bill by Senator Nelson to restore that PE in high school. The second priority is to ensure advertising on school district property is nutritionally appropriate. This is a bill we are still shopping around. It's a difficult one in that we're having to sort of vet through whether or not we're talking about campus or are we talking about sporting events. And you can imagine in Texas, those are some debates we really we have to consider heavily. You can see the third one is to support complete streets. This bill will be filed very soon. It's a refile from last session. And for those of you familiar with community and regional planning, you'll know this right away. This is a built environment bill. And this is asking the Texas Department of Transportation to really take into account the bikeability and walkability of streets when they undertake new projects or substantially redo old projects. So we will be supporting that. And the last one actually we're pivoting a little bit. Our official priority is to ask school health advisory councils to address sugary drinks sold in schools, but we actually have a bill filed. It's HB 217 that I think is going to fit nicely in this priority, and it's asking that there be restrictions on sugary drinks sold during school hours. So I'm going to actually really just not touch too much on the early childhood priorities. These are, as a decision by the steering committee, are priorities that we will pursue after session. They are not, at this time, really viable legislatively. I did want to note, for those of you interested in early childhood, we did have a pretty big win a couple of years ago, which is that when the Department of Family and Protective Services redid their minimum standards for child care facilities, they did put a limit on screen time, so no screen time for more than 2 hours a day, and they restricted sugary drinks to special occasions, so like birthdays and things like that. For food systems and access, this is always an interesting area. I get asked to talk about this a lot because there's this kind of this paradox, or what seems like a paradox, about food insecurity and obesity. But actually, oftentimes we're talking about two sides of the same coin with what is available to low-income families and what is affordable and around, really, in terms of access. So the partnership does want to weigh in on that. We have a bill this session, is SB 133, that would allow underused or substantially underused state property to be used by communities for gardening. And so there's also probably going to be some bills around this related to incentivizing private landowners, although those haven't been filed yet. For those of you where this is a particular interest, I would just note that there is a newly formed legislative caucus, the Farm to Table Caucus in the House, and they will be working a lot on these types of bills. So for the 83rd legislative session, if you are interested in getting involved, there are lots of opportunities. We are right in the middle of budget discussions with the Senate Finance. They're having hearings actually as we speak. If you're interested in getting involved, you can go to the Partnership for a Healthy Texas website and sign up for email alerts. And I promise you, you don't get a bunch of them because I manage the listserv where they go out, and I haven't sent any in forever, and I promise not to blast your email box. But basically what that is you can receive information that we send out. So we send out a newsletter of sort of what's happening. And also, I'll just tell you sort of anecdotally, last session, when there is sort of a big push where it would be really important for us to have either you make a phone call or come visit the Capitol and talk to a lawmaker, if it's something that you want to support. We had an attempt last session to repeal coordinated school health in schools. And so we knew this was probably going to be added as an amendment to a bill. We were very worried about it. We sent a notice out on our email list and asked people to call. And so the following day, part of my job is to go into offices and sort of ask them not to repeal coordinated school health and to work on that. And when I did that, and all the members of the Partnership for a Healthy Texas Steering Committee did that, when we walked into offices, the first thing that a lot of people said was, we've been getting calls about this all morning, tell us what's going on. And so that really helps. I know sometimes it feels like you're just going into an Excel spreadsheet where they register your physician, but it definitely helps put things on their radar because there is just a ton going on for them right now. So I'm going to just wrap up there in terms of what to expect from the 83rd legislature. We have a lot of work to do for obesity prevention, but we're optimistic. We're not facing the same budget shortfall, so I think there's a lot of opportunity this session.
Great. Thank you, Lauren. So now we're going to shift a little bit into the role of the academic community in public policy. And one of the first things I can tell you is that we don't advocate or lobby. So that's our #1 rule here. But our main charge in response to public policy is to provide the information that legislators and stakeholders need to make informed decisions. In this way, we can be sure that the policy is based on the best evidence and evidence-based practices. We really like to provide this for a variety of reasons. One is through our research, we often know about policies that have been implemented. We look for associations with the behavior outcomes and physiologic outcomes even that we're looking at. So for example, we know that in schools that tend not to have a lot of vending, that kids tend to have lower BMIs and they tend to consume less sugary drinks when they're at school. So there's just examples that we can provide based on research that we do. The other thing that we can do a lot of times is to point out if there's an unintended consequence. So one example of something that we have found is an unintended consequence that really was a good piece of legislation or it's actually local policy, was in child care centers in one county in Texas. They started looking at their kitchens and requiring that they have commercial kitchens in there, which is good in terms of food safety. However, a lot of child care centers are older houses, and the cost of doing something like that, upgrading, is prohibitive because they don't have a large profit margin. And so a lot of them just said, well, we're not going to serve meals anymore if we can't pass inspections, health inspections. And so they couldn't even cut up fruits and vegetables to serve as snacks. So what happened is that the unintended consequence is they're serving less fresh fruits and vegetables and relying more on packaged snacks. So the kids get less overall nutrition. So a lot of times our research can uncover things like that then can be punted to groups like the partnership and say, this is something we found. Is there any way that you can address that? So our tools here include data, so the research studies that we've done and surveys, compilations of best practice, and then syntheses of data through meta-analyses, systematic reviews, and expert opinion. So one of the things that's very important for us at the center is that we are able to translate research to the general public. So a lot of times when we do research and interpret it in terms of p-values, when you're trying to explain that to an audience, it can be difficult at times. I can recall when I first started talking about childhood obesity, for example, and I was trying to explain to a reporter what the 95th percentile was, instead of calling it child obesity, I talked to him for 30 minutes, and at the end of that conversation, he said, now what were you saying again? Because it didn't make any sense. So we really have to be able to couch our findings in terms that are relevant. So just an example of a few of the projects we're doing in reports. One of the reports that we're using for our providing to our partners is the Accelerating Progress in Obesity Prevention report, or the APOP report. This report came out in May from the Institute of Medicine, and they convened a panel to look at all the obesity recommendations, and there were hundreds of them, and kind of compiled them down into 5 core goals and related strategies that are based on the evidence. These strategies can then be used by the partnership when they're looking at their priorities. And in fact, it's pretty interesting. Several of those have been on the priority list for the partnership for several years now. 2 of our faculty served on this committee, Bill Cole and Steve Keller. Another example of some previous testimony and information that we've provided is through our research projects here. So one of the research projects up there is the Texas Childhood Obesity Policy Prevention Evaluation. So what we're doing, and I got it wrong, it's the Texas Childhood Obesity Prevention Policy Evaluation Project. And so what we're doing there is looking at data from schools that have safe routes to school, how it's been implemented in Texas, and which ones show the biggest increase in child physical activity or in active commuting to school. Another project from the center is the School Physical Activity and Nutrition Survey that we've done in conjunction with funding from Department of State Health Services. And what we've been able to do there is provide nutrition, physical activity, behaviors, and obesity data for 4th, 8th, and 11th graders in the state over time and by region of Texas. You'll see one other example here of Dr. Shelton Brown, who's in the middle of the slide there, using some of his data on economic cost of smoking. And so he's testifying using those data to provide information for legislators to use. One of the new tools that we have this year is on our website. So we have a newly designed website this year that we're very proud of. And as part of that, we have specific resources related to the 83rd Texas Legislature. As seen here on the website, you can click in the middle there where it says 83rd Texas Legislative Session, and it will take you to a bill tracker. And so what we're doing is we're following bills that we're generally interested in that are related to our topic area. One of the reasons we're very interested in the outcomes of these relate to us on a variety of levels, but I can say as a nutritionist, most of the public health nutritionists in the U.S. are funded through federal legislation, for example. So when bills are passed, that can directly relate the field in terms of how many people are in the field, what they get paid, who's out there. So this is all very interesting to us on many different levels. So if you look here on our website at www.msdcenter.org, we have tools to educate the community about these topics. And so if you look across there, the bill tracker is broken down into 4 general categories that are related to our vision and mission. And those include school health, food policy, obesity, and tobacco. And you can click on them to browse by topic. So one example here, and Lauren mentioned this in her presentation, is Senate Bill 134, which was filed by Senator Jane Nelson. And it tells you the status of the bill right now, a brief description of it. And what's really nice about this is it refers to past bills too. So you can look at the bill that was in the previous session or so and what happened to it and at what point was it left pending or not passed. The other thing I forgot to say, going back to that, is if you look at the bottom 2, we also draw on references for these. So again, because we are so evidence-based and we do a lot in pulling that evidence together, we like to cite where we get that information from. And that's at the bottom of each of these sections. So if you had clicked on the Senate bill in the previous slide, you would end up here. And so this is at Texas Legislature online, and this tells you more information about the bill. And so it tells you where it is, where it was filed, and also shows you the text of it. If you click on an author, that takes you to the Texas Tribune Legislative Directory. And that's very interesting because you can see who their staffers are, you can get contact information, it tells you how long they've been in public office, it talks about everything, Twitter feed, lots of information about each of the individual representatives and senators. I had mentioned this previously, but with this legislation from 2011, you can also click on that, and that will take you to Texas Legislature online and give you more information about the previous bills as well. And again, I had mentioned that before, our vetted resources at the bottom. One of the things I wanted to talk about within those vetted resources too is several times we will have blogs that we have done on various topics. And so if a blog is related somehow to this legislation where it highlights some of the literature that might be supportive for this legislation, we link back to that as well. When you are in these different sections, we want to make sure that you scroll down, because a lot of times there's lots of different subcategories and bills, and we're adding to this all the time as new bills get filed. So it's going to look differently next week as we update it. So one of the things we're doing, this is the first, as I said at the beginning, in a series of webinars that talk about different issues that will be coming up for the legislature and kind of highlighting what the evidence is. And so on the next slide, it talks about the upcoming webinar topics. So we will be talking a little bit about the public health impacts of a smoke-free Texas. We have faculty here who were involved with the Surgeon General's report on smoking in youth, and they will bring some of that evidence in that webinar. We'll also be talking about physical activity in public schools. We've done a lot of research there. We have a lot of data to support what works and what doesn't. A recent paper just came out in the American Journal of Preventive Medicine, for example, that talks about how much additional physical activity you get with each of the sections, like recess or evidence-based physical activity within a school day. So it really kind of quantifies it for us there. We will be doing a webinar topic on complete street legislation. So what's happening, how can we do it right, specifically around children and community. And then finally, we will be talking about the cost and benefits of a penny per ounce soda tax and talk a little bit about nutritional issues, supporting why this might be a good thing, how it tends to affect body mass index and other evidence from the research. So just what we found with different interventions. So we'd like for you to stay tuned to our website, and we can provide our upcoming webinar schedule as we go. And in addition to that, we'd like to also highlight our 7th annual Michael and Susan Dell Lectureship in Child Health. In this, we're sharing knowledge to inspire a healthy world. And this one is a special lectureship because we're honoring Dr. Guy Parcel, who was former dean of the School of Public Health, and recognizing him for his extensive experience in child and adolescent health research. So we'll have 4 excellent speakers that will be coming to talk about various aspects of adolescent health on the afternoon of February 28th. So come join us if you can, and the website is there for more information. And so at this point, if you have any questions, we would like to answer them.
And just as a reminder, you can access the chat dialog box by going to the little green box at the top of your screen, and you can then type in your questions, and we'd be happy to answer them.
So I have a quick question actually for Lauren, because one of the questions I have with childhood obesity in particular is, I know that, and you mentioned it, that the legislators are very busy, they have a lot on their plate. And so an issue like this, we've been talking about it for several sessions now. So how do you keep it alive and vibrant and at the top of their priority list rather than letting it fall? Because I know that that's very difficult for us to do. So
yeah, and actually I'm glad you asked that, because it really is a consistent challenge, and it's something that we talk about because there was a feeling after last session, and some of that I think had to do with the nature of the budget situation, that when you are in a budget deficit like we were last session, anything that is prevention, whether it be even just in child health, including anything related to obesity, becomes less of a priority than things that have to be funded or pay the bills now kind of thing. But I think what our challenge is to keep it relevant, and I think where we landed on that was really to consistently be able to talk about obesity in multiple different ways. So we're not just saying childhood obesity all the time. Now we're trying to make sure that we are talking about the impacts, so the health impacts. So we're talking a lot more about type 2 diabetes. We're just adding more to the discussion, trying to sort of tie childhood obesity to the outcomes that we know our state is dealing with in terms of health-related issues. But the other big approach, and hopefully we'll be successful with this, is to target specific committee members based on their interests, and not just focus on the issue of childhood obesity, but sort of, and I think a good example of this is with Complete Streets. So Complete Streets is heard in the Transportation Committee, which is not necessarily a committee that always hears about childhood obesity, whereas our public health committees are more familiar. So we approach them with childhood obesity, but then we also talk to them just about bringing them examples of how the built environment can have an economic impact, and how, so we're talking to them about it, but we're also talking about things that resonate more with them, things that are more in line with their interests, because oftentimes, not always, but oftentimes a member on a committee is there because that was an interest of theirs, or professionally they're involved. So I'm trying to add, I guess the short answer is really trying to add a little more dynamic to the discussion.
Well, and that makes sense too, because when you talk about an issue like childhood obesity, it's a very complex issue, and it affects a lot of different systems. It's not, it doesn't have one cause, it doesn't have one solution, and so it does affect a lot of different areas of our life.
Yeah, and it's so interesting too, because in terms of Texas is really a diverse place, and so it can be easy for me really to focus on the overall picture of Texas, but when we talk to lawmakers, we also need to be talking about their community. So if they're in an urban community or rural, the issues tend to be different, and so really targeting our message based on what is going to speak to them most. Okay.
Well, if we don't have any other questions, we thank you very much for joining us today, and want to thank our fabulous panelists here, and hope you'll join us for the next in our series. Again, that calendar will be posted on the website soon, and thank you all very much for attending.